Okay. Well, that was as far as presenting up here. Be nice to have you guys back again, especially I think for a lot of patients, even real-time recipes, because sometimes it's, hey, where do we start? And even some of the books that we had that you had mentioned, maybe we'll put those up on our website as well. So. A couple of their stories, definitely kind of hit home. In grad school, you're studying quite a bit. I actually had the nickname Snack Mix. So, anytime that you're stressed out, understand that you're going to typically crave things that are sweet, salty, fatty. And I think of it as the danger hour right when you get home. If you're stressed out, sweet, salty, fatty, and you have chips, I mean, that's what you're going to go to. So I remember growing up, my mom always had cut up vegetables in the fridge, and we had a big bag of peanuts in the pantry. Nice thing about growing up in the country, we were 30, 40 minutes from the closest McDonald's, so it wasn't exactly an option. So some of those stories definitely hit home. One of the things I wanted to go over shortly today, so one of the most common injuries that we see this time of year, Dr. Bouch had already mentioned raking. Raking and golfing share a lot of similarities. So I've been out on the course here. It was snowing here yesterday, so now we're in kind of whatever they call that second winter / spring. One of the main things that we see with golfing injuries, and you guys have heard us before, always talk about that rule of opposites. So especially this time of year, we tend to see a lot of lower back, pelvis, SI type pain, and some of that comes from one-sided rotational activities. So if I'm swinging a golf club, and for some golfers a lot more than others, especially if you're a double bogey, triple bogey golfer, well, if I'm doing a one-sided rotational activity over and over and over, we see the same thing in people that constantly stand on the same leg or cross the same leg, or guys that sit on a wallet back pocket. It can start to cause twisting of the pelvis. And when we eventually see that, it usually ends up, we'll get what's called SI pain. This triangle-shaped bone here is called your sacrum, and the sides of your pelvis here are called your ilium. So the one thing we always tell our golfers, if you can, if I'm swinging every few holes or even at the end of the round, I'm actually going to try and take my club. Now, I tell people to do this. Do I always do it? Not exactly. But I try to remember, if I'm going to be swinging, however many times, for me, a right-handed golfer, I'm going to try at least every few holes or at the end of the round, even if I don't have a club in my hand, to be swinging, just even with my arms, just the opposite way. If I keep going one way over and over, and we see the same thing with raking, if I'm going constantly one way, it's not so much the day of. So let's say I rake for 10 hours. We usually don't see the injury that day, but a day or two later, you fatigue one side of the muscles more than the others. Then we hear the common story, I just bent over to pick up a towel and my back went out. Typically, it's what did you do the day or two before that. So if there's one thing that you can do as far as golfing goes, we're always going to talk about rule of opposites. Whatever I do one side, I do on the opposite. Same with raking. The other thing that we'll sometimes see when people start golfing, if I look at my pelvis and anatomically, if I turn my feet, so really good golfers, sometimes you'll see them, they almost walk with their feet out. Well, when my feet are pointed out, it actually allows for a little bit more mobility of the hip. So if my feet are straight ahead and I'm trying to hit it like a Bryson DeChambeau or someone in your local golf club who hits at 300 yards, and that one hip, if my feet are straight ahead, I can actually start to load up a hip. And so sometimes just taking a little bit of pressure off that, I can actually turn my feet out, and that'll actually help get my pelvis to move through a little bit easier. So rule of opposites, pretty common, pretty simple, easy things. Whatever you do one side, do on the opposite. We've also talked before, especially in this plane, we always talk about rule of opposites. The more I can be doing extension, going backwards, pretty simple, easy stuff. So that was my bit tonight. Hopefully, as far as some of the golfers out there, we can get on the course here pretty soon. It's been kind of cold this week, but rule of opposites, if you can maintain that for golfing and raking, hopefully you can avoid some of the injuries this spring. So thank you. I'll bring up Dr. Matt. I think it's insured.
So along with Dr. Aaron, I'm going to talk a little bit of moving into, as the season changes, we're changing our activities, and as Dr. Bouch was talking about earlier, A lot of people, winter is not the most active time of year. As we start getting up, moving again, we're changing the muscles that we're using. We're doing different movement patterns that, may be new to us. Maybe we're picking up something like golfing this year, or just we haven't done it in months. And so, we need to build into it. Your bodies are mechanical machines. With anything that's mechanical, it requires yearly maintenance. The more you maintain it, the better it lasts, longer it lasts typically. And so we're just going to talk about a few, simple kind of rules, to follow going into the summer, and then some just general body maintenance. So the 25% rule, that can be used with warm-ups into leading up to an activity, but also to starting in, something like walking. So 25% rule, that can be used for something, say, like Dr. Aaron was talking about golfing. You're not going to go to the driving range, grab the driver on your first ball, try to hit it as hard as you can. You're going to hurt yourself doing that. And so usually you start with, just a kind of general warm up, and then as you start swinging, a good way to do it is, swing 25% speed, for a few times, swing 50% speed for a few times, swing 75%, and then finally you're warmed up into hit it 100% that you can. You can also do that with things like walking. So if you haven't walked all year, the end of last fall, say you were walking a mile, a good way to start in the spring is walk for a quarter mile. That's 25% of where you were last year. You can walk for a quarter mile. When you start getting better at it, you can walk for a quarter mile, say twice a day, so you're up to a half mile. Start building up from there, move up to a half mile, start doing a half mile a couple times a day. That's a good way to start moving gradually into exercise, so you're not overdoing the, not putting excess wear and tear on the joints that you're not used to, and kind of just start slowly easing the body back up to exercise. Dr. Aaron mentioned the rule of opposites. For a lot of times, a lot of people spring, getting the garden beds ready, starting to pot stuff, starting to plant. And that's a lot of bending forward, a lot of raking, a lot of different things like that. Make sure every 15-20 minutes you're standing up, getting some stretches in, going the opposite direction, so you're not just weeding the garden for an hour in a row. You try to get up, you throw a disc in your back. We need to make sure you're just not doing things just repeatedly in one motion all the time. Remember the rule of opposites, and then you'll stabilize the spine. And so, like I was talking before, our bodies are mechanical machines that require maintenance. Kind of three keys to think about are, spinal joint stability, muscle tension flexibility, and then balance. These are three components that, if we can maintain these, we greatly reduce our chance of injury. And so, for the spine, there's a lot of different things you can do. Three great exercises that you can do are called the Mcgill Big Three. And so I'm going to leave this as homework for you guys. If you go on the internet, just Google Mcgill Big Three. It's going to come up. There's a lot of YouTube videos on this stuff. These are three great exercises that they have a lot of progressions to them. Almost anybody can do them. Obviously, if you have pain or discomfort with it, stop doing it. Ask a professional if it's right for you. But the three exercises are called the curl up, the side plank, and the bird dog. What they really do is they work on your core. The core has the front part of it, the sides part of it, and then the muscles in the back along your spine. These exercises hit each one of them, and they're great, stability exercises. Because with a stable core, it reduces. You need a stable core to basically do anything. And so, if the stronger your core is, the less chance you have of injuring yourself. And so, as you find, these videos on YouTube and stuff, they'll talk through the repetitions of how to do it. But, it's recommended that you hold each rep for 8 to 10 seconds. This is kind of initially as you're building a muscle, that's about as long as it can go before it starts to fatigue. So hold each rep for 8 to 10 seconds, and then you'll start at 3 sets, or a period of sets where you'll go 5, 3, 1, and then you can build up from there. And the next, muscles as we sit at work, as we are right-handed, always doing rotation one way. We're going to get stronger one side. We may have torn a hamstring when we were younger. All those injuries catch up. Muscles are going to heal differently, and so the better we can maintain our muscles, the less likely we are to injure them. And so, a couple tools you can use for kind of maintaining muscles are, foam rolling is great. You can use a Theracane. A Theracane's kind of like that shepherd hook looking thing that you can get the muscles in between your shoulder blades. They're great for having at your desk. You can use a tennis ball where you put it in a long sock, roll up against the wall, get it great in between the shoulder blades, get the muscles on the side of your butt. And so you can get really creative. Rolling out is great for the butt, legs, calves, in between the shoulder blades, the mid back. And so, some of the things that foam rolling is believed to do is, if you work out, if you foam roll after it, it can help reduce the kind of the delayed muscle soreness that you may get the next day, 2 days later. If you roll out before you do an activity, say if you roll out before golfing or working out or anything that you're doing, it warms up the muscles, with that friction. It can break up some of that, muscle adhesions that you get. And so it has a lot of different benefits. Another thing to think about is, dynamic versus static warm-ups. If you're going to be doing an active, activity like golf where, static stretching before, not the best, thing. That's not going to be what you're going to be doing during the exercise. And so more of a dynamic exercise where you're moving to warm up the muscles is going to be better than doing a static stretch. You're actually going to get less power doing a static stretch before, an activity. So that's another thing to think about. And then balance. Not only is balance important as we age, we start to lose our balance, but the better balance we have, the less likely you are to slip and fall, trip, stumble, things like that. So you don't have to be, older to work on your balance. Any athlete, anyone can work on balance. Working with athletes, somebody that is a really good athlete, you can take them through a series of balance exercises, and you'd be surprised at how poorly they may perform. And so a couple simple balance exercises you can do are single leg stances are great. You can do them standing in the grocery store or anything. A good goal would be to try to be able to stand on one leg for 30 seconds. When you can do that, switch legs. When you've progressed to 30 seconds pretty easy, you can close one eye, close the other eye, and then you can do where you close both eyes. Once you've mastered that, you can do where you add a little instability. Simple way to do that would be fold up a bath towel, stand on that. That'll give you a little bit of unstable surface. And then you can do the same thing. If that's too difficult for you, you can do where just put your feet together, and that'll work on your balance a little bit. And once you can do that, you can do one foot in front of the other. That'll work on your balance a little bit, and then you can progress to where you're doing it. If you're worried about falling at all, a good way to do that is do it in a corner where you can do stability, so you're not less chance of falling. Because the last thing you want to do is fall and hurt yourself. And so like I was saying before, our bodies are very complex mechanical machines. The more you maintain them, the more you come up in with a daily, weekly routine that you do, whether it's foam roll every day, foam roll 3 times a week. Make sure you're coming up with some kind of simple warm up in the morning. You can do a cool down in the afternoon, and then make sure before you do an activity that you normally don't do, make sure you're warming up for it, getting prepared, getting the body prepared for it. So just come up with a daily maintenance program. Build up into the activity, duration, intensity, warm up for your activity, and then, as Dr. Aaron mentioned before, micro breaks, rule of opposites. And so, with this in mind, hopefully you can have a productive and injury-free summer. And so, Dr. Lexi's going to take it from here.